Yeah, this is fun. I mean, it's when you look at this, your body responds correctly based on the environment. And when you're looking at light therapy, it's something, it stimulates cell production. And every disease out there, if your body builds cells faster than they break down, that's called health. And anything that can facilitate that cell production is a good thing. I think you're going to like it, particularly, I mean, when we talk about, today we're going to talk about depression, anxiety, and I like Dr. Zulia because she's got Eastern and Western. She's got a balance, which is kind of crazy because Western it addresses the symptom with a toxic chemical, and that's foolishness. But they do have the authority now. Oh, good, Zulia's here. And Eastern works with the body's harmonic processes, so the body can build and detox and recover. I mean, that's the only thing that makes sense. So Dr. Zulia Frost, medical doctor, clinical director of Recharge Health. God bless you. I missed you, dear. Trained in Western medical science and Eastern philosophy, expertise with integrated light and energy therapy, and over 10,000 patients. That's the key. That's experience, and we got to get into finding out what your body is doing. Dr. Zulia, remind me, how'd you get from medical doctor to founder of Recharge Health?
Well, it was quite a long journey for me, but it just basically to say that once you experience something traumatic and tremendous in your life, like I had to survive basically trauma. I was a patient, so I saw from being a doctor, I became a patient, and I kind of realized the one important thing is missing in the whole healing process is that energy. And I start researching, I started going through the, all this, all the courses. I've just, my curiosity was infinite. I wanted to know how can we get the energy into your body so your body could do the work which it's programmed to do, can do the healing work. And so it took me on a path to learn about neurostimulation, to learn on a path about photobiomodulation. I wanted to understand how body works energetically. So I went to study Chinese medicine. and then when you apply it in practice every single day, and you see people recovering like crazy with very, very fast rates, you just ask yourself, why nobody else knows about this? And I wanted also to take the piece and give people to their homes, because as you know perfectly well, as a therapist, you could do in that hour just very little. I mean, a lot, but also a little. So you want to continue that healing process when people are at home. And that is actually brought me on the path of finding right people, partner with right people to create precious devices which people can take home and continue their healing. So that is in a nutshell.
Fantastic. I mean, I'm so looking forward to your presentation. Red light therapy for anxiety and depression. Please share this. I'm looking forward to.
Excellent. Okay. Well, let's start first of all to understand what the actually depression is. And to be honest, the subject is so huge. And I wanted to talk long, but I understand you have all limited time. So I'll try to do in a nutshell as much as I think most important things. So first of all, depression is a mood disorder that causes persistent feeling of sadness, loss of interest, like people become obsessed, disinterested, and flat, so to speak. So, and it is kind of common sense. People know that depression typically caused by some neurotransmitters. People know them about serotonin, dopamine, etc. So the neurotransmitters which regulates your mood, regulates your sleep, your appetite, they become discoordinated. And of course, typically mainstream conventional medical approach is just to be very mechanistic and just to give you what is lacking, yes, in the form of a drug. In my view, this is a limited approach because you really need to understand what lies behind it. And hopefully today I can explain to you, and hopefully today I can also tell you that there are some natural ways you can use to help yourself to come out of the depression. But as you know, it's never one thing, but we will try to nail it today. So this is probably most complex slide in my presentation, but I thought it's important to know. So there are three primary hormones which engage in this interplay. So we have serotonin, and everybody knows about serotonin. And here I want to tell you that, by the way, serotonin is 95% produced in the gut. Only 5% produced in the stomach, and only, sorry, in the brain. And only after you produce serotonin in the gut, then it can go and affect the brain. So the second hormone is engaged in the mood regulation. It's norepinephrine. And it's kind of always like, if you know, adrenaline is released when you're stressed, norepinephrine is released constantly, but in small amounts, and primarily developed in your adrenals, and also can be produced in a small amount in the brain. And of course, dopamine, my personal discovery was that I didn't know that 50% of dopamine is also produced in the gut and only 50% in the brain. So here you go. That's already, the answer is coming to you, yes? So these three major hormones, there are some more, of course, neurotransmitters which engage in this process, but they regulate your mood. If it's too much, people might feel anxious. If it's too low, you can maybe feel that your battery flat, like with low dopamine. Now let's move on and just understand a little bit more of the complexity of the whole scenario. In my view, everything kickstarts from the concept of persistent stress. So when we are persistently stressed, not just like one-off, but we live in a stressful situation. And may I remind you that it could be anything. It could be that you live in the environment where, you know, you constrained in a family where you have abusive partner, or it may be that your boss is really overly strict and you have to run and do everything. So it could be some little things, but it could be something which is depleting your body because you constantly stress. Your stress hormone is constantly released. So this persistent stress would typically coincide with some maybe emotional trauma and something looping you cannot forget, or which can give you a sense of free-floating anxiety, which means you just don't know, something isn't right, and you lose the sense of reality. Maybe that could even cause you loss of purpose because you can't be on the go all the time. And so my discovery about depression and anxiety was the fact that it's actually linked to this depletion of energy resources in the body. How? Because if you're in a constant perpetual stress, you constantly running out of the danger. So your body switched into the sort of catabolic processes. You're constantly breaking down, and sources for various source of energy, simple energy. So you start craving sugars because it's very easy fuel for you. You start craving for fats, and so it's all in the name of getting energy. And when it's persistent, continuous, and chronic, what's happening? This process is constantly consumes your resources. And if you have some trauma, if you have some attack of the virus or bacteria, your body doesn't have enough energy to counterbalance it and fight it to produce inflammation, a real inflammation. So your body only limited to produce some low-grade chronic inflammation, and it doesn't have energy to produce immune response. So you become immune suppressed. You feel you burn out because by the end of the year, you used up all your cortisol, and you have hormonal dysregulation. And by the way, by that time, you won't be able to sleep. You will be struggling to fall asleep, and sleep deprivation make you aged, dissatisfied. And this is all cause circadian rhythm dysregulation. And remember, we talk about this. So circadian rhythm is actually powered by melatonin. So melatonin orchestrates the rhythm of day and nights, but it's also attached to other hormones. So now you start producing hormones in the wrong time, and then you can't put, shift your weight, become unhappy about your appearance, and all this hormonal dysregulation, sleep deprivation leads to also on the cellular level to activate accumulation of oxidative stress. With low serotonin, for example, in a prolonged way will cause you SAD, seasonal affective disorder, and so on. So this in combination with the change with your neurotransmitters, which you were told that, your neurotransmitters out of the kilt. But together with this, it's just mounting up. So then you have lack of neurotransmitter synthesis, nutritional deficit. Because why? Because you have leaky gut syndrome, because your body does not assimilate nutrients because your gut stopped working. Microbiome dies and your gut is not working. So, and then you become deficient, malnourished, and particularly with deficiencies in B12, D3, thyroid hormone, that is kicking in of neurodestructive damage to neurons. Plus, by that time, you start taking sleep medication, some drugs. Maybe you escape by drinking, wine, trying to slow you down, your stress. And so you increase toxicity on the body, leads to further hormonal imbalance.
Wouldn't that be just corrected by a selective serotonin reuptake inhibitor, a drug that they don't know how it works, that has a side effect of suicide and suicidal thoughts? That won't correct all the magical stressors immediately?
Well, that's my point.
I'm sorry, Doc, that's totally sarcasm.
I know. And that is my point. Because, you start taking serotonin reuptakers, and what you do, you just increase serotonin. And now science telling us that actually low serotonin does not cause depression. So what's the point? And so you need to really address that situation. You need to address issue of stress. You need to address issue of lack of fundamental body energy. And then, in the end, when you get to this chronic inflammation, then you overload the body with all sorts of drugs, and that is only perpetuate the problem.
This is why I love talking with you. We got the same philosophy. If your body builds cells faster than they break down, that's health. And physical, chemical, and emotional stress puts you in that fight or flight state, and your body is responding correctly based on that state. I mean, it's your blood supply to the gut shuts down. This is why even in Parkinson's and every time a neurologic condition, we've got to heal the gut first. How does now? I know light therapy helps. How does the flex beam? How does that photodynamic therapy really help the body's processes of buildup and breakdown of tissue?
Yes, I'm coming to this. I just want to tell you this is a very good representation how our gut microbiome reacting to stress and how it's connected with the brain. So as a result, we actually damaged our brain, and the beautiful vagus nerve, it's connected, and it's like a direct line between gut and the brain. So yeah, let's talk about photobiomodulation. Photobiomodulation is now proven to that it improves microbiome, okay? And by doing this, it improves brain neurochemistry. There is a beautiful study, which I took the link here, which demonstrate that within 2 weeks' time, using photobiomodulation device, red and in infrared light, 3 times exposure, brings one of the family of the microbiome, it's called alabaculum, to 80% increase. Like, it's incredible. So because gut is light sensitive, and when you have gut light sensitive, it absorbs photons, and you create diversity of microbiome culture. And in addition to this, from modulating microbiome, you also have anti-inflammatory effect. Again, we found that when you stimulate with light, you have reduction of pro-inflammatory cytokines, but increase in anti-inflammatory cytokines. So this is your anti-inflammatory. Blood circulation will help to improve gut functioning, yes. And of course, we talk about modulation of the gut microbiome. So if we talk specific to depression and anxiety, first of all, we activate energy production. We repair damaged mitochondria. We upregulate ATP energy molecules production. And if you shine on the head, for example, you can improve the prefrontal cortex, which elevate the symptoms of depression. Enhancement of the peripheral blood flow, reduction of the stress, oxidative stress in the body. And we talk about this as well, about the fact that melatonin under near infrared light specifically produced inside the cell and has antioxidant properties. So this will result in reduction of neuroinflammation. And then we stimulate, of course, vagus nerve. We put the flex beam on the body, and we will improve gut motility and repair circadian rhythm.
The big thing when you look at inflammation, and melatonin is an antioxidant, what inflammation is not a dragon attacking you. It's how the body regenerates tissue. The repair process, and it's called oxidative metabolic process, except that can create free radicals. So melatonin deactivates those free radicals from harming healthy tissue. So it makes inflammation work so your body can regenerate. And that's why I like vitamin C as an antioxidant or an anti-inflammatory, where chemical anti-inflammatories like non-steroidal anti-inflammatories destroy that process of inflammation. So you just know that inflammation is a healing process of the body, and the photodynamic therapy helps it. There's also that it just because one of the things that computers do, although everyone's looking at the computer now, it emits a blue light, which interrupts melatonin production, and this can lead to a problem. So some lights can damage that production, other lights can help it.
That's absolutely truth. And I am with you on that, because we dramatically change our lifestyle. Even in my lifespan, I mean, we change. We hardly outdoor. We don't receive our near infrared lights. We're not in a green space, or if we do, we of course feel fantastic, but it doesn't last. So we really need these devices with us to help us to go back to health. So here's a couple of the recipes, so to speak, with Flex Beam. I want to introduce you. So the protocol is for sleep and anxiety support, and you can see where placement of the Flex Beam right over the heart, right over the sacrum and low abdomen to stimulate the parasympathetic response, and also over the neck to again improve the blood flow to the brain, and of course on the gut.
Okay, know that there's an action called viscerosomatic. Anything you do to the viscera, which is the organs, affects the body and the digestive tract. So where you're looking at this, where it's placed, that affects that parasympathetic nervous system. So you need a balance of this fight or flight and the rest and digest. Anything that you do to stimulate that parasympathetic, the organ tissue, is going to get you in a better balance.
Absolutely. This if you don't know, you're just depressed or anxious, use this protocol. At least you can start with this. If you feel that that depression is coming from your gut. This is specific to gut protocol. And I totally agree with you, Dr. Bergman, because I love to use it on the stomach a lot. So you could see that the sort of cross technique. You here, the position is over the adrenal glands. This is a position over the liver. This position over the descending colon. And of course, sacrum, because all innervation comes from the sacrum.
And liver is also called the emotion. And anytime you got physical, chemical, emotional stress, that liver's working so hard to process the epinephrine, norepinephrine, the stress hormones. So, I mean, when you're looking at its liver and spleen, that spleen is checking every red blood cell, passing it over. This is where bile production is. So, I mean, the placement of this and the physiology of it is incredible for the system to regenerate.
Yes, absolutely. So if you try this protocol, don't expect miracles. You need to work with your body at least 3 weeks, the very bare minimum. Normally, the more chronic you are, the longer it takes. Sometimes it takes a couple of months. So, but don't lose your faith, because it's only gonna help. It's only gonna do good thing. This is
Doc, one thing I got to tell you, and you're going to like this, because eventually you're going to come to one of our clinics, Huntington Beach or Mexico. I have big signs up, and the sign says, expect miracles. So you got to, I mean, your body is built by God. I mean, you put the energy in, you're going to get the cell production out. Sorry to interrupt you, because I'm really enjoying this.
Well, we come to the end to it, but what I was going to bring my point that if you have systemic situation like I described to you, because really depression is an expression of the whole body going through breakdown, and the first thing you need to do, you need to come out of that stressful pattern. You come out of the stressful pattern, and you also provide the body with basic fundamental energy, the fuel. Your body can do the work, but all you have to do, recognize where it's coming from, where is your weakest point, and just use flex beam to energize the cells there, energize the cells of your stomach, and energize the cells of your heart, liver, bloodstream, whatever. You just follow the cues from the body. And I am very sure you're going to nail it, because people are telling me a lot that they feel much better. They recover from their injury, but they say, I feel much more enthusiastic and energized and feeling like I'm meeting next day with a joy. It tells me something.
Really good presentation. So when, here, let me see, I'm trying to pull this baby up. Excellent. Okay, now you've worked on over 10,000 patients, and everything that you're doing makes sense physiologically. I mean, you're stimulating the organs. The fact that this helps with mitochondrial production, if you know, you've got 70 trillion cells, and these cells have little energy producers in there called mitochondria. Every medication negatively affects the mitochondria. And I'm talking everything from birth control to antacids to non-steroidal anti-inflammatories. And that decreases the energy production of the body. And this helps the energy production of the body. Now, dear, you've worked on over 10,000 patients. What kind of results have you seen, particularly in this?
The results come, I would say, approximately within 2 weeks' time, you start seeing the shift. Inevitably, everyone hits some increase in their symptoms. But you know, Dr. Bergman, you already talk about this, that the fact that the body needs this inflammation. So in a sense, once you provide the body with energy, the body self-reinflame, but it's for a short period of time, and it's controlled inflammation. And then you continue, and then you see gradually within 2 months' time, you see the gradual improvement. We, of course, talk about stress management. We talk about nutritional supplement. I really do encourage my patients to watch their medication they're taking. I encourage them to stop unnecessary medication straight away. However, if they're already become dependent, like corticosteroids, they need to go through the process to reduce that medication. And that is important, because you need to work with the body, because you've been providing all that from externally, where your body needs to learn to, again, start building up these nutrients. Of course, we talk about diet. Of course, we're talking about just, healthy thoughts. Stop thinking destructive. Recognize there is, you're here for reason. Recognize that, all what is around you, it's built to please you. It's beautiful, and you should experience gratitude. When you experience gratitude, each hormone flows, and it flows so beautiful. So very soon you find yourself, there is no need to worry. Human beings designed themselves to focus on something they don't have. No, look what you've got. Don't focus on that.
What I tell patients, because there's always a pattern interrupt, that their minds get stuck in that vortex of anxiety, stress. I say, well, do you read any religious texts, like, Bible, Torah? And they'll, oh yeah. Well, doesn't it say in there, the more you worry about stuff, the better it turns out? And they'll smile and get, no, I guess we're supposed to have an attitude of gratitude, give up, let go and let God, and the emotional stress is equally going to affect you as physical stress. And when you mentioned viruses, fungus, bacteria, none of those are predators. They're not going to attack healthy tissue. They're scavengers. Mm-hmm. So if your body is under physical, chemical, emotional stress, you are not building healthy cells. And so those pathogens have a job as part of the ecosystem to eat that up. Just think of a leaf falling off of a tree. The soil, bacteria, funguses, and mold got a job for that ecosystem to turn it into soil. You build healthy cells, you're resistant to any disease.
So true. I totally believe in this. Although, I start off my medical career, I believe that each disease comes from externally. The disease comes at you, and then you have symptoms of that disease, and then you have a specific pill to fix that. So, but who taught me? My patients, these 10,000 patients, they taught me that this is not the case. They told me that if you provide that fertile soil of your body and bring it to healthy balance, the body could do miracles. You can repair, but you need to get body into balance. And the first job is to give the fuel, to give the energy. That's why I think it's absolutely fundamental, together with everything you take, nutrition or, even medication, yes, you need to have energy device, or go outside, exercise, be outdoor every single day, see the sunrise, watch the sunset. It's necessary. Walk in the woods, because leafage reflects the infrared light back into your body.
I like that. You mean if you take time and put energy and effort towards something like, I don't know, your health, you get better health. If you put time and energy in a relationship, you get a better relationship. Time into a garden, you get better garden. Okay. So you have to, but to prioritize yourself is to honor the energy that's inside of your body. And because so many people they have to work, or their kids or their spouse or this or that. No, you got to take care of the caregiver. There's a stewardship to this body. And understanding that you're more energy than matter, physical, chemical, emotional stress, you got to take care of it. God, Doc, just because you're describing a pill for an ill and you're saying that's insane. We're not going to address the underlying stressors. We're just going to give you a chemical to change your physiology. Yes. What caused you to break from that? Was it your experience with the patients? Because this is not the standard medical philosophy. This is radical.
No, I gradually arrived to this because I was observing my patient to responding to this. And it was most fundamentally because I work first part of my career a lot with the chronic pain patients. So I run a pain clinic. And so people come to me with lots of stock of meds. What was surprising for me that you take them off that medication and suddenly they repair themselves very quickly. You give them stimulation, energy, and they just but on that, they already start recovering. So they don't want to go back to Oxycontin, or I forgot the name for this, their drug, yes? So they don't want to go back to very heavy medication because we don't feel well on them. You know, you become foggy mind, you can't think straight, people become addicted as well. So it's a thing, but patients really told me the case. And myself, I don't like, I understand that if I'm in pain, I understand this is a signal of some kind of damage in the body. And I don't want to kill that signal because that signal connects my brain with that part of the body where it's coming from. And maybe then my brain give the command to the body to fix it. But if I block that signal, my brain will think everything is okay. You know, how can it heal itself?
I just had a conversation. I'm talking like 30 minutes ago, okay, with a patient. You know, the pain. Yeah, the pain's a fire alarm. It's not the problem ever. Okay, it's telling you that there's a problem. So a medication is like a fireman coming in and blowing out all the fire alarms. Good. It's a lot quieter now. You're much healthier. You know, and every medication causes the problem it's designed to treat. This is why antidepressants cause suicide and suicidal thoughts. Muscle relaxants cause muscle spasms. It's everything. High blood pressure drugs increase stroke symptoms because it causes vasoconstriction of the brain. It's insane. You cannot do this. But what you do by utilizing this, you're allowing those cellular processes to break down and build up. That's the oxidative metabolic process. The red light or the light therapy, the photodynamic therapy deactivates the free radicals, stimulates the cell production of those energy producers, the mitochondria. So you literally get a chance to tear down bad cells and build healthy cells without a negative effect. I got a couple of questions too. What about patients with implants? Okay, I've got a boatload of people with stents and pacemakers and stuff. Can you utilize this with stents and pacemakers, everything else?
Yes, you can, because fundamentally in the mechanism of photobiomodulation, when you use red and near-infrared lights, it's a direct photo stimulating effect on a cell. There is no thermal effect. Of course, if you go in a band of infrared lights, then you're going to be hitting the tissue, okay? But for example, in flex beam, we only have, it's just pure stimulation with light. So you're not going to be expecting anything go hot inside your body. And it didn't happen because lots of people wrote to me and said, oh, I've got this hip replacement, I've got this device. Unless somehow this device, because now we have exponential growth in all sorts of implantable devices in the body. So unless it somehow interacts with the lights, but I don't know to date anything which could be effective, and it's fine. It's fine.
Yeah, I'm just saying because I have recommended this for every implant, every stent, everything, and I've seen some very good results. And I just had the first time, and I've never even heard of this before, a stent in the bile duct. And it's like, because normally, the gallbladder drains into the same area as the pancreas in the duodenum. And I can feel that common bile duct. I can work it. I can drain out the bile sludge. I can't do it with the stent in there. And it's just, this is dumb on top of stupid. But at least I can use the flex beam. I can have the patient diaphragmatic breathe. And bile is a superfiltrate of blood. And I mean, you got to see some of our live blood cell analysis. This guy's blood, instead of separate cells, they're stacked worms. It's disgusting. And so that's going to tax the spleen. The spleen sends that garbage over to the liver. The liver makes this bile that clogs up all the bile ducts. And the doctors are going, okay, well, it's clogged. Let's put a wire cage in the tube that drains it. Sorry, Doc, I had to vent.
Yeah.
But the flex beam is good. I mean, you can actually use this over that area to help the metabolic process.
Yes, in addition to just using lights as an energy device, remember there is also element, because you're stimulating and you're providing energy to the cell, you can repolarize the muscle and muscle will relax. And that's what you want, because lots of pain comes with a spasm tissue, whether it's endothelium, the blood vessel spasm, whether it's a gut, spasming gut, or just simple skeletal muscular. So if you target lights specifically to that specific area, you expect relaxation, muscular relaxation, and that's already relief. And then if you use, for example, with that, techniques adjustment, that would eliminate the problem altogether.
Beautiful. I kind of want to just like talk with you forever. So, but I know there's a lot of questions up there.